Let's face it, many women just aren't happy with the size of their chest.
And for those looking to downsize, there is a new procedure for breast reductions that promises to leave smaller scars.
Health Watch reporter Beth Galvin is here now to tell us all about it. Beth?
Well, Amanda and Russ, having a large chest can cause back pain and shoulder problems. But going smaller often left women with major scars that are hard to hide. Now a new procedure can give women the lift they want with much smaller scars. They are everywhere. But when it comes to breasts, bigger isn't always better.
And when you're having the sagging, it is not cute.
That's why 40-year-old nurse Sarah Alexander has wanted a breast reduction for years. So what stopped her? The scars.
When you're dressing and undressing, you don't want to have reminders of the things that you've had done in the past.
Then Sarah heard about a new technique that promises less noticeable scarring.
With her procedure, there are few cuts, short scar, higher lift, and that's what I want.
In the past, breast reduction surgery left women with pretty big scars, so they didn't feel comfortable wearing low-cut or revealing tops like this one. But now with the new techniques, there is little scarring, so they can wear pretty much anything they want. The traditional breast reduction leaves scars that look like this, lollipops with half circles under each breast. But the new technique does away with those half-circle scars.
Okay, my dear, we're going to draw some lines on you.
Atlanta plastic surgeon Dr. Amy Simon will perform a breast reduction known as SPAIR on Sarah. She'll remove tissue from both of Sarah's breasts, lift them, and shape the remaining tissue to help the breasts maintain their new shape.
Perfect. I like it. And rather than just remove excess skin and sort of hope that all the breast tissue falls into place and looks nice and looks natural, I think it's a better approach to actually go in and shape the breast tissue.
All right, we're here.
As Sarah rolls into the operating room, Dr. Simon scrubs up and the anesthesia begins.
Okay. Injection.
The SPAIR procedure is just one type of short scar breast reduction. Other Atlanta surgeons use similar techniques to leave patients with smaller scars. But the SPAIR procedure includes reshaping the remaining breast tissue to improve the appearance of the breasts.
Well, recently I think patients have come to expect a lot more, and there are a lot better procedures available to deliver a better result.
3 weeks after Sarah's surgery,
Ooh, I feel that I look great.
she's loving her new look.
And just being perkier, not going south anymore.
If you compare Sarah's chest before and after surgery, the difference is clear. Even with less than a month of healing, the scars are hardly noticeable.
Mine is virtually smooth. Looks like a little pin scratch.
And the surgery did a lot for Sarah's pride.
I'm looking better in my clothes, and I don't feel like I have to slump over to kind of cover the large breasts. I'm standing in the mirror like every morning just watching myself because I'm amazed at what she's done.
Dr. Simon says the SPAIR procedure can also be used for breast lifts and breast reconstructions. She says women need to see several surgeons before they decide which reduction technique is best for them. But Russ and Amanda, it's important to know that there are other options out there for this surgery.
So does this SPAIR procedure work for any woman?
Well, one criticism of the SPAIR technique is that it may not work for women with extremely large breasts. But again, it's important to do your homework, to check around who's doing this, what they're doing, maybe do a little research on the internet to get the best doctor for you and the best procedure.
Yeah, she was obviously very, very happy with the
Yes,
results.
she is.
Thanks.
Thanks, Beth.